Welcome everyone to our electronic Board of Health meeting. Due to COVID-19 pandemic, Regional Council is practicing physical distancing and councillors are participating electronically. I would now ask Stevie Netolochny to please do the roll call.
Chair Redman.
Here.
Councillor Armstrong.
Here.
Councillor Clarke.
Here.
Councillor Erb.
Here.
Councillor Foxton.
Present.
Councillor Galloway.
Here.
Councillor Harris. Councillor Jaworsky had indicated he will be joining us later. Councillor Jowett. She was here.
Yeah, she's.
Councillor Kiefer. Councillor Lawrence. Councillor McGarry.
Present.
Councillor Nowak.
Here.
Councillor Shantz.
Here.
Councillor Strickland.
Here.
And Councillor Vrbanovic had indicated he would be joining us a little later. I'll call for Councillor Harris. And for Councillor Kiefer. All right, we've got everyone present with the exceptions of Councillor Harris, Kiefer, Vrbanovic, and Jaworsky.
And Lawrence, right?
And Lawrence, thank you.
Thank you, colleagues. I would ask if there's any declarations of pecuniary interest under the Conflict of Interest Act. Seeing none, there are no delegations to this meeting that have registered. So I would now ask Dr. Wang for a COVID-19 update. Welcome, Dr. Wang, and you have the floor.
Thank you. Kathy will project my slides and help advance them for me. Thank you, Kathy. So if we go to the first slide with the epi curve. So our current weekly incidence is holding at approximately 50 cases per 100,000. The percent positivity is at 2.5%, taking into account interim data. And our reproductive rate is at 1, which reflects the fact that our rates have plateaued. We are currently managing 316 active cases and 22 active outbreaks. Our indicators are stable, but are no longer improving week over week, as they had throughout the latter part of January and early February. The indicators still place us within the red control zone of Ontario's framework. Worryingly, in our case and contact follow-up, we are now starting to hear of increases again in gatherings with friends and family outside of immediate households. An update about the variants. Next slide, please. Variants are now reported on our dashboard under the Epi Curves tab. You have to scroll down after the tabs. To date, 59 total variant cases have been identified in Waterloo region, 4 confirmed for the B117 variant, and 55 cases have screened positive for a variant awaiting confirmation and for the specific variant to be identified. This represents approximately 7% of all cases screened for the variant in Waterloo region. Variant cases have been identified in connection with a variety of settings, including long-term care, congregate care, workplaces, schools. Today, we are reporting the first school outbreak connected to a variant case at Monsignor Doyle Catholic High School. Currently, there are 3 total cases associated with this outbreak. No further action is required at this time, as the impacted cohort was already dismissed as a result of the original case. Public health is treating every single case of COVID-19 as a potential variant before a variant is identified. And we continue to work closely with our school board partners to ensure appropriate infection prevention and control practices are in place. This is not unexpected. Provincial modeling projects that variants will become the predominant strain in March. The percentage of our cases that are variants will increase over time. The number of settings where a variant or an outbreak associated with a variant will be identified, will increase. This underscores the imperative for Waterloo Region residents to continue practicing with utmost vigilance the recommended public health measures. This includes staying at home unless you need to go out for essential reasons and avoiding gatherings with others outside of your immediate household. This is what works to slow the spread of COVID-19, including its variants. If we go to the next slide, please. We've received questions regarding the laboratory screening that's done for variants, so I thought it would be helpful to go over this quickly. Public Health Ontario initiates testing for variants of concern once a sample tests positive for COVID-19. The initial screening results that indicate whether a variant has been detected come in a couple of days after the test result. The confirmation of the specific variant can take a couple of weeks. This is why we have implemented enhanced case and contact management for all cases of COVID-19. We are treating every single case as though it may be a variant. We are not waiting for a screen positive nor a confirmation. Our enhanced processes include using a lower threshold to identify who is considered to have had a high-risk exposure, recommending enhanced testing, advising contacts and their household members to continue to stay home except for essential reasons. More broadly, we're strongly advising that all residents continue to practice strict public health measures, limiting close contact with others and staying at home to the extent possible to limit the spread of COVID-19, including its variants. In addition to implementing enhanced case and contact management, public health is engaged in a great deal of unseen COVID-19 work that is not reflected in the case data on our dashboard. This includes monitoring cases and contacts, monitoring workplaces, investigating outbreaks and potential outbreaks, and supporting infection prevention and control. In September of last year, staff began tracking this type of work. Beginning in September, public health staff have monitored more than 1,500 workplaces. 74 have been monitored in the previous 2 weeks. Monitored 428 cohorts or groups from schools, childcare, before and after school programs, or post-secondary institutions. 48 have been monitored in the previous 2 weeks. Investigated more than 500 long-term care, retirement home, and other congregate care settings. 63 have been monitored in the previous 2 weeks. Our dashboard reflects the positive cases and outbreaks in Waterloo Region, but these indicators help illustrate the unseen work, the preventative work that is limiting the spread of COVID-19 and reducing positive cases. Next slide, please. In closing, it is not unexpected to see an increase in variant cases identified as Public Health Ontario, the provincial agency that runs the provincial lab network, has substantially increased their testing efforts to identify variants of concern. This is a good thing. We now know with more accuracy what our prevalence of variants is. Provincial modeling forecasts that variants will become the predominant strain in March. Keeping up with public health measures is therefore imperative to limiting the spread of COVID-19, including its variants of concern. public health measures work to protect against COVID-19, including its variants. Stay at home unless you need to go out for essential reasons, and avoid gathering with others outside of your immediate household to slow the spread of COVID-19, including its variants. Thank you. I'd be happy to take questions.
Thank you very much, Dr. Wang. We do have a few questions. Councillor Shantz, you have the floor.
Thank you. I don't have a question, but your talk about unseen work twigged something for me. I was talking to a constituent this week who was contacted by Health Ontario that she was possibly in contact with someone at one of her places that she was at, and she just wanted you to know that she struggled a bit with Health Ontario, but she called the region and she said everybody was fabulous. So I wanted to pass that along. She didn't have enough good to say about them. She was just gushing about how well she was treated and how much you helped her. So I wanted to pass that along.
Thank you very much. I'll pass that along.
Councillor Clarke, go ahead. You have the floor.
Thank you, Chair. Thank you, Dr. Wang. I have two questions about the variants. You mentioned that because that you are now treating all cases as if they were variants, including changing the definitions of high risk. My understanding is that currently we define high risk as 15 minutes or more of contact within 6 meters unmasked. So my first question is, can you tell me how that's changed? And my second question is, what do we know about the effectiveness of vaccines with the variants?
Yeah, thank you. So they're not major changes, but they are the expert recommended changes with respect to case and contact management. So for instance, there'll be a more detailed look at the type of contact that has happened and whether the person was wearing a mask, not wearing a mask, and if they're in a work environment wearing eye protection or not. So, it still fundamentally is that you need to keep 6 feet away and, 15 minutes or more cumulative, not necessarily have to be 50 minutes or more at any one time. But there are a series of enhancements in terms of the determination, in terms of the determination that that somebody is considered a higher risk contact and therefore would be recommended to go for testing or isolation. So it's a more refined assessment, and then it's a lower threshold for treating those cases as high risk contacts. And in response to your question, based on the evidence that we have so far with the vaccines that have been approved in Canada to date, we're not seeing any concerns with these vaccines being able to be effective against the variants that we have at this time.
Thank you.
Councillor Clarke, do you have any more questions?
Nope, that was it. Thank you.
Thank you. Councillor McGarry, go ahead.
Thank you very much, Dr. Wang, to you and your team. And I think it's really helpful for the rest of the community to understand the type of work that we do behind the scenes, is in particular during this period of time. It tells I think it helps tell the tale so that we can have probably more credibility as council members to continue to encourage people to follow public health guidelines. And even if they feel that they're not getting sick, you just look at the sheer workload that we're demanding from our regional staff. That tells the tale. Just wondering if I've frozen and you can hear me.
I can still hear you.
Yeah, you froze, okay. Catherine, but we can hear you.
Great. My main question. Okay, the main question that I have is more on the variants, and I understand the testing capability takes to come back after being screened for the variant.
And secondly, does a rapid screening test have the capacity to be still sent forward to identify whether there's a presence of a variant in that rapid?
Okay,
Wang?
yeah, sure. So what the rapid test, I'll talk about the one that's most frequently used, like the one that's used in long-term care homes now. That's called the PanBio test, called a rapid antigen test. So there's lots of tests. That's why not all of them are exactly the same. But for the one that's most widely used, you know, in the workplace, places where they've been piloted so far by the province, for example, if you screen positive, you know, it will detect if it's a COVID case, even if it's a COVID variant case. So the rapid test will give you the result that you're positive. Now, rapid tests do have more false positives and especially false negatives, but if it's correct, if it's accurate, it will say that you're positive. For all the rapid tests of this type, there needs to be a confirmation by the regular PCR test. So the person then has to go to get a test at an assessment center usually, or sometimes it could be available in their workplace as well. But they have to get this regular test, and then it's this regular test that is screened for the variant. So they can't screen it off the rapid test, they screen it off the regular test, which would then confirm whether it was a true positive or not. They take that and then they screen for a variant. It takes a couple of days. And then the confirmation takes a couple of weeks.
Councillor McGarry, do you have any further questions?
So the performance of rapid tests would be the same as for the regular variant, but they can't be used to confirm the variant.
Thank you, Dr. Wang. Councillor Jowett, I almost called you Dr. Jowett. Councillor Jowett, go ahead.
Oh, there's a promotion, eh? Okay, so thank you, Chair Redman. So I just want to introduce a bit of a concern that's been kind of coming to us through the business community, and I know we're maybe going to hear about it again. It's more about the variant and the concern of another wave, and of course trying to manage refraining from another lockdown. I mean, if you hear some of the stories, which I think you're going to, actually, the press has been asking lots of questions. We have some businesses that I think we're gathering the stats to be able to present to council as we speak. And I'm just wondering if, and Dr. Wang, I don't want to put you on the spot because I understand the position you're in. I'm just wondering, is there anything coming out of WHO or CDC or the province? And I understand the feds are changing some of what their thoughts are around this. Given the variants and given how precarious the supply is currently, and I know it's coming, is there validity and efficacy or increased efficacy around talking about more masks, better masks, more filters, or just something that can sort of help stave off some of these concerns, because business is so incredibly frightened of another lockdown. And I'm just wondering if council's sort of interested in a little bit of that discussion, and certainly Dr. Wang, where your parameters lay or your interests lay in that particular question.
Oh, I thank you for the question, Councillor Jowett, and it is undeniably extremely difficult for our business community right now, and I understand very much what they would be concerned about. I mean, they understand best, but what I mean is I can see where they're coming from. This is a question that is being actively looked at both federally and provincially. I keep asking every week if we have an update. There are expert groups looking at it, but they have also recently come out that, you know, based on the best available evidence to date, what they're finding is the bigger issue is people are not wearing masks consistently, and they're not wearing masks really well. That is more of an issue than you know, the masks that they're recommended to wear. So the masks that has been recommended to be worn by the general public are more and more, we're seeing that they're effective. But the bigger problem seems to be that, and we certainly see that in our case and contact follow-ups, that people don't always wear them. And sometimes people don't wear them properly. So that appears to be more of a significant issue. But in terms of whether or not there will be any updated recommendations about the type of mask that is recommended for the public, for healthcare workers, etc., that is an issue that is continuously being monitored by the federal and provincial expert bodies.
And so would you suggest that perhaps we should be looking at cloth masks as something that would be a limited tool instead of it being broad use of tools? Excuse me.
Sorry, I'm not sure I understand your question.
I'm still seeing lots of cloth masks and
yes.
Right. And so I'm just
yes.
wondering, should we be trying to encourage people into wearing surgical masks?
Oh, I see what you mean. Well, people can wear, higher grade masks if they choose, but our recommendation is that people wear 3-layer masks, like the Public Health Agency of Canada recommends. And, if they wear them when they should, and they wear masks that fit snugly, they should be quite effective. And so what we're really wanting people to do is just, continue to wear these 3-layer masks and wear them when they're supposed to.
Okay, thank you for that. And thank you. I can hear your empathy. I really can. I know that you're putting lots of attention to sort of how we can get through this and maybe and advocation up to the province, and I appreciate that. So thank you very much for taking the question.
Thank you.
Well, I see no further questions, but I would like to welcome Councillors Jaworsky, Vrbanovic, and Kiefer, who have been able to join us. Thank you very much. Our next agenda item is COVID-19 vaccine rollout update. Oh,
Madam Chair, Councillor Foxton had a question.
Okay, Councillor Foxton, go ahead.
Thank you, through the chair. Dr. Wang, so the 3-layer cloth masks are considered okay? Are they as good as the 3-layer surgical ones? I did go and buy a box of the surgical ones, but I also have the 3-layer masks, so cloth ones. Is one better than the other?
They're almost as good as the surgical ones. They're quite effective if they're worn properly. So that's what's been recommended by Public Health Agency of Canada, and what we're recommending as well. The province recommends the 2-layer masks. What we're saying to people is we recommend you have the 3-layer masks, but at a minimum, you should have the 2-layer masks. The 3 layers, I believe, are better. And so, yeah, that's what we're recommending people wear.
Okay, thank you for that.
Apologies, Councillor Foxton. I thought you were just really excited and waving at Dave and Barry and Carl. So our next agenda item is an update of the vaccine rollout, and welcome Deputy Chief Hilton. You have the floor.
Good afternoon, and thank you very much, Chair Redman. I have Connie McDonald, who's also part of the task force, here to join me as well, and we'll be delivering a presentation related to the vaccine rollout. But before we get started, as you know, through the vaccine rollout, we've been fairly specific with our priority 1 population, with our long-term care home and high-risk retirement homes, and also healthcare workers. And those specific groups, we had a very specific way of reaching them and to actually book those appointments. What we're finding with the announcement from the province last week, that with the adults who are 80 years of age and older being moved into our phase 1 vaccination rollout, and then a further categorization of our healthcare workers into prioritization of highest, very high, high, and medium, that we required to have a way in which people could pre-register for their vaccines. So I am very happy to announce, with a great deal of work from the task force and with the region of Waterloo, that right now we are launching our phase 1 pre-registration system for COVID-19 vaccine. This is located on the Region of Waterloo website, and it's all those that are in our phase 1 priority populations who now can pre-register for their vaccines, including our adults that are 80 and older. For those that are unable to register, they can call the region service first call center at 519-575-4400. This is live now and will be of great assistance in terms of us now planning our full rollout for the vaccine. So I definitely encourage those that can pre-register are adults, recipients of chronic home care, adults 80 years of age and older, essential caregivers in long-term care or retirement home, healthcare workers, Indigenous adult, seniors in congregate setting, staff and residents, and then staff in long-term care and retirement homes. I'm highly encouraging people to do this because it's certainly a more efficient way for us to plan the appointments. But more importantly, there is an opportunity, even if people have availability for to come into one of our clinics quickly if we happen to have somebody who has canceled an appointment. So it allows us to have a contingency plan in terms of delivering those vaccines. So this is hot off the press and just launched, and it is available on the website currently. If we can move along on the slide deck here, and I'd like to actually explain how we're actually going to get to the 10,000 doses per day and beyond. Next slide, please. So as before, I've talked about the types of clinics that we're looking at in terms of our vaccine rollout. As we know right now, Grand River Hospital is our fixed site where we have been administering vaccines for our healthcare workers and also long-term care workers as well. That site has been up and running very well. We are also looking at our mobile clinics that have been going to our long-term care home for residents to administer vaccines there. So those are the two clinics we have been using currently based on the vaccine that we have right now. And I will add that currently we are only dealing with Pfizer vaccine. We do not have any other vaccine, and we have been receiving our allocation in the last couple of weeks on time as well. We are working toward 2 large public health clinics that I'm hoping to announce their locations by the end of this week. Those are, as I've said in the past, in the north and in the south, and that's to assist with our broader healthcare sector, essential workers, once we start moving into our phase 2, but also once we start launching these clinics, they can be used as a pop-up for populations such as when we're looking at our 80 and older population as an example. We are also working with 8 mid-size clinics that are primary care clinics that will be also within the full region, looking at rural and being able to look at where our current needs are. So this is, we are working with our primary care and pharmacy who are also assisting us currently, I might add, in our mobile clinics currently as well. And then we have hopefully some smaller sites that once we get into our more steady state that we can start transferring over, like our flu vaccine, into primary care and pharmacy. But those pop-up sites could be used additionally if we see a particular population that is needed. Next slide, please. So, and again, I'm going to just add caution when this slide deck was made, and it's an evergreen plan, which means it will be ever changing as we continue to see vaccine, if we increase with our vaccine supply and or other vaccines that come into the plan as well. So looking at our hospital clinic with the initial startup of 400 doses per day with a maximum target of 650, we know we've achieved that and will continue to work toward those goals. Our mobile and on-site clinics as well, with a ramp up of start rather with 500 and then moving up to 1100. As you see with the two large public health clinics, these numbers go from the initial startup to 2,500 to almost 4,000. And the purpose for the ramp up is just to allow us to troubleshoot, to make sure we have some quality control within the clinic as well before we get to a full capacity. And then again, our smaller sites with an initial startup of 800 doses and then up to 2,100. And as you can see at the bottom of the slide, that we are looking at, although we say, how do we get to 10,000 doses a day, which is definitely the information General Hillier had provided, that he was looking at vaccination task force to be prepared for. We are currently targeting for 12,000 doses per day. And again, I will add that is all vaccine dependent. Next slide, please. So just another depiction of how we see this ramping up and the time frame. Bear in mind, we did have vaccine we didn't have our vaccine supply in February, January, February, where we had the slowdown there, but we have been told that we will make up ground into March and April to reach our goal. Next slide, please. And again, another depiction. The dates that you see on the right-hand side obviously have shifted. They will be out a bit and not necessarily on target, but we are beginning our adult chronic home care, as you see. In March, sorry, I got lost in the numbers there. One of the things that I did want to point out is that the large numbers you see on the screen are based on the province, their estimate of what Waterloo Region's share of this particular population is. Next screen, please. And we've got this, somebody had to, sorry, as you see me go blank there, somebody had updated my slide deck. So as I had said, our pre-registration system is up and live. This is only for those that are eligible in priority in phase 1. All of the eligibility list there I've listed earlier. Next slide, please. And I have to say thank you very much for the update on the slide deck. I wasn't sure it was ready. So for the next 3 weeks, we are continuing our first dose vaccination, again, on all eligible long-term care and high-risk retirement homes, staff, and essential caregivers. We know we are coming to a conclusion of that particular group. We are continuing our vaccination program with the highest priority frontline healthcare workers. And as you can see, that is all patient-facing healthcare workers, assessment centers, testing centers, teams that do support outbreak, including our shelter workers, medical first responders, paramedics and firefighters, and then further into our community healthcare workers who serve specialized populations. Home and community care workers caring for seniors in chronic home, and then of course our adults who are 80 years of age and older. Next slide, please. I would like to turn it over to Connie McDonald to give you a preview of what's been happening in communications and community engagement.
Great, thank you so much. My computer is slowly catching up with me here. So I know that, hi everyone, Connie McDonald, the Chief Strategy and Communications Officer for the region of Waterloo. I'm here today as the strategy lead for communications and community outreach as part of the task force. I know that the deputy has presented the IMS structure, but wanted to give you a little bit more detail about what the communications, community engagement and outreach work looks like related to the task force. So I feel very special. I'm the only person in the IMS structure who has a box on the chart that is green and orange. And that is to reflect the day-to-day work in terms of strategy and oversight, as well as operational implementation. On the operations and implementation side, two phenomenal leaders. I have Julie Kopflesch, who you're all familiar with, leading the communications group with support from the Waterloo Regional Police Service, Grand River Hospital, and Dawn from the region's call center. And then also Fazia Bag, who's an anti-racism and equity advisor at the region, leading the community engagement and outreach working group, which I'll talk a little bit about sort of at the end of the presentation, but certainly a group made up of some great community leaders who are doing some really great outreach in the community. So in terms of communications, you know, I don't think that there's anything talked about more in our community, not only at work every day, but also around the dinner table. And when you're having safe gatherings with family members over Zoom, everyone wants to know what's going on with vaccination. When are we going to get vaccinated? We hear information from the province, we hear other information. So for us, it's really about being that trusted source for vaccine information in the region, making sure that we're providing a regular flow of information and updates to the community, addressing misinformation that does circulate from time to time, and then also celebrating key milestones and the people behind achieving them, because we know that this is an unprecedented undertaking and there's so much work going on right now behind the scenes to bring this to life. So three communication streams, one around vaccine rollout, and this is the one that was put in place immediately as the task force was formed, and that really speaks to accountability and transparency. Around the work of the task force, around the work of vaccine rollout. And so everything that the task force does is posted for the community to read on the task force website, on the region's website. And that includes, you know, meeting notes from task force meetings, every update in a release, and continuing how we're updating the community on decision-making and accountability for vaccine rollout. The second stream, absolutely vital, speaks to vaccine safety, vaccine confidence, and addressing vaccine hesitancy. And so working really closely with credible sources, nationally, internationally, provincially, and locally on communicating to our community around the safety of the vaccine and the choice to be vaccinated. And the last is vaccine access. And this is a growing field of information as the clinic strategy unfolds of when is it my turn and what do I do when it is my turn. So we have a number of different communications tactics in place, you know, weekly live hits with the community update with Deputy Chief Hilton. Again, the websites that we mentioned. We also, our 24/7 Service First call center has been taking many calls from residents every day and working to support them with their vaccine questions. Social media campaigns, media updates, a communications toolkit, which I'll share. And then also we're looking to launch this week a stakeholder bulletin so that we can continue to keep organizations, community leaders, and our partners informed in terms of how they can continue to help to support the rollout. So one of the really important pieces in our website materials, there's tons of stuff online, and it's really important to us that it's accessible. And so we do have a translate function for all of the vaccine materials on our website. And you can go on, hit translate, and get that vaccine information in any language of choice that you see there. And absolutely important, and a question that has constantly come up as we've been working with different community partners and community groups. There's a communications toolkit, which I mentioned, which has everything from posters and fact sheets to pre-written, pre-organized social media content for anyone to learn about the vaccine, but also to be able to share vaccine information. And so we welcome the community to inform themselves and also to use those resources to inform others. These are trusted sources of information. They're updated frequently. I don't think I've ever worked on a communications initiative that has changed so frequently, which is one of the downfalls or risks or hard parts of this work, is that, the information does change a lot, but we're certainly doing our best to get whatever it is we know today and can share out there as quickly as we possibly can. I talked about the importance of celebrating our people. And so it was really great. Sherry Greeno, who is the communications manager for Waterloo Regional Police, had the chance to go behind the scenes at our vaccine clinic and interview the staff who are actually making this happen. It's a campaign called Here Comes the Sun. You may or may not know that started at St. Mary's Hospital by a couple of staff there, that when a patient with COVID gets well and leaves the hospital, they play the song, Here Comes the Sun. And so within the vaccine clinic, there are tons of suns. People hold up sunshines for selfies when they get vaccinated. And this is really seen as a sign of hope, resilience, togetherness, getting through this, and really celebrating those people who, you know what, this has been an incredibly complex undertaking, and we want you to be able to see those people behind the scenes making this happen. The last thing I'll touch on is community engagement and outreach. So working alongside the communications team, a really great group of leaders in the community who are working on targeted communications for priority populations, and in particular, Black, Indigenous, and racialized community members who have specific information needs when it comes to vaccination. And we want to make sure that we're delivering the vaccine in a culturally safe and culturally sensitive way. And so this team has a number of goals and actually held their first community stakeholder information session last week that was really well attended. And I'd like to invite them back at some point to provide a more fulsome update on all of the engagement work that they've been doing. I can't really do it all justice, but I can say that there are information sessions now happening with different stakeholder groups frequently. There are resources being put together with different partners. And really this group is helping to ensure that our vaccine distribution plan is informed by the community that we serve, and that really will meet the needs of every resident, and ensuring that we have an equity and anti-racism lens in this work. So that is the end of my presentation, and I'll turn it back over to you, Deputy, for questions.
Connie, does this mean you don't want to answer any questions?
No, I'm happy to. We are both here to answer your questions.
So colleagues, I think the hard questions should go to Connie and the easy ones can go to Shirley. I have a list of speakers. Councillor Foxton, go ahead.
Ladies, you have me so excited. What a great rollout. What a great plan. So Shirley and Connie, if I get you right, 80-year-olds can register to get the shot now. I'm asking this to be very clear because I am going to Facebook this out. I am going to send it to all the churches in my municipality and make sure that people are able to assist them in doing that. So what I also want, Connie, if you could email me the link and the information so I can get the word out, because they're the ones that are most afraid. And they're the ones that are calling me. So this is amazing. You're making me really happy. The sun's shining here. Thank you so much. So just give me the information. And if you, with your nods, I'm running with this. Thank you.
So everybody, you've made Councillor Foxton's day. Councillor Jaworsky, go ahead.
Thanks. Mine was a similar theme, but just for clarity, because I heard Hillier say today that to mark your calendars for March 15th to register, but I understand this is pre-registration. So maybe you could just provide clarity on that, either from one side or the other. I'm more interested in the regional registration site and how that, or the phone number, and how that works. So whoever wants to take that.
Thanks, Dave. Who'd like to take that? Deputy Hilton?
Sure, I can take that. Thanks, Chair Redman. So yes, the province did announce that they will be rolling out their call center and also their registration as well online. I believe they provided a date of March 15th. However, this allows us with our own pre-registration to now look at how we're going to, what modality of clinic is best served with the populations that we're looking for. So the fixed site, the mobile sites, or pop-up sites, for instance. So our pre-registration will be a registration. So, and then hopefully our goal is once the provincial one is up and running, the two systems will speak to one another.
Okay, that part helps. Thank you very much, Shirley.
Thank you. Councillor Shantz, go ahead.
Thank you. I had some questions at our council meeting last night. It was a really long meeting and it was late when I tried to answer them. But I think I'll send a link to this webcast. There's really good information here. So my question was going to be where will the 80 and above go to get their vaccine? That was a question that was asked of me. Is that part of the pre-registration then, that you would ask them, you know, what kind of access they need, or how do you determine how you're going to do that?
Deputy Hilton or Connie, who wants to take that?
I can certainly take that one too.
Okay.
So yes, so the pre-registration will ask if there are any access concerns or mobility concerns, which will help inform what type of a clinic that the individual could go to. So for instance, we may use the Grand River Hospital Clinic, knowing that our you know, some of our population are healthcare workers. What we're trying to do is run concurrent priorities within phase one so that we're reaching all of our phase one priorities. So when I had mentioned earlier that there is the potential for a pop-up that has easy accessibility, because for instance, Grand River Hospital, we know where the clinic is, there are a few stairs. So we have to take that into consideration. So there is a pop down for asking that question so we can identify. So it's just allowing us to be able to assess the need of the individual and what's the best clinical type for that vaccine.
I was thinking more of location than type. So when you say a pop-up clinic, would that be a pop-up clinic in one of the smaller towns, or are those all going to be in the cities?
No, that it could be one of our community health centers. It could be one of those 8 primary care led clinics that we will identify where the need is at the time. So it could be any of those areas.
Okay, is there anything you need from us from as rural mayors in terms of providing those kind of sites that would make it easier to have something local?
I do believe with our logistics and planning and operations, and also through our primary care and our Ontario health tables, so through KW4 and also through Cambridge North Dumfries, that they have been making the reach out to those clinics already in terms of which are the best able to facilitate operating a clinic within.
Okay, thank you.
Thank you.
So Councillor Shantz, embedded in your question is a willingness of all the township mayors. I realize that you're volunteering your 3 colleagues, the townships, that you're ready and willing should that assistance be required, correct?
Yes, I think I can volunteer them that, and I think we would all say that we would really like to see that access, particularly for our oldest constituents in the townships.
Thank you. Councillor Galloway.
Well, thank you, Madam Chair. And like Councillor Foxton, you've made me very happy as well on this particular day. And I think Chair Redman will particularly appreciate that, given the conversation that we had earlier today. my concerns have been certainly allayed. It's really good to see the rollout now being kind of more publicly presented, and people having the confidence that things are actually now in place and rolling out. And there's no better example of that than the pre-registration system. I'm very happy to see that we are going with our own system and not waiting for the provinces, although that may create some complications later if they don't speak to each other, and residents may be being confused whether or not they have to register in both locations. We'll have to manage that. I also want to pay particular note to the community engagement outreach program, particularly that Connie described. I think that's excellent and something that we can be very, very proud of. I don't know how we compare to other health units in that regards, but I suspect that we are probably, hopefully at least in respect to many, ahead of things. The question I have is in terms of timing. So the phase 1 people can, if you qualify under phase 1, you can now pre-register. It's live. You can phone or you can do it online. That's great. Will there be any information provided to the individual either at that time of pre-registration as to any kind of an anticipated timeline? Because that'll be the next thing that needs to be managed is people's expectations. Now, once they're registered or pre-registered, will I wait a week? Will I wait 2 weeks? Will I wait a month? How long might I wait? Is there any interface in the registration system that provides any kind of a prediction, or are we loath to try to predict anything approximate for fear of it not happening in a timely fashion?
Deputy Hilton, can you answer this?
And the pre-registration really is just putting somebody on a list. So it really is hopefully alleviating some of that angst that we've been hearing around people being concerned that they're going to be missed, or that how do I let people know that I belong in a particular prioritization or a particular phase. So it doesn't provide a date in which you will receive your vaccine. It's allowing us then to look at, okay, what's our next priority group? What's the next sequencing? What's the next vaccine clinic? And then be able to start scheduling based on the information that we do receive in the pre-registration, because we still have quite a list of people within phase 1, but it allows us to be also more nimble in determining which clinic is the best setting for the remainder of phase 1. So it doesn't give a date, unfortunately, or even a time frame, but it really, I just want to encourage people that it puts them on a list that then allows us to start planning those clinics further in advance as well, which is all very vaccine dependent.
Okay, well, thanks very much, Shirley and Connie, for this update, and I hope that we can continue the good news on the rollout. This is really important to people. I think all of us are hearing from people anxious about the vaccination rollout. We hear bits and pieces from other parts of the province, and it's really good now to get a firm picture of what we're rolling out, and it looks really good. Congratulations.
Thank you, Councillor Galloway. Councillor McGarry.
And thank you, Madam Chair, and through you. My question was really about some of the conversations that we have been hearing in the community regarding, who's on the list and who hasn't got their vaccination yet. So is the best thing to do just to let folks know that even if they weren't sort of considered for the first round, and even though those individuals may be in seniors congregate settings, that within 3 weeks they should be a priority in getting their vaccine?
Deputy Hilton?
You're speaking specifically of our seniors in congregate settings?
Yes, we've had several complaints. Yeah, we've had several complaints from those individuals that may be in seniors congregate settings that may be vulnerable and older, but they're not technically a retirement home or long-term care home. I sort of had asked before about this, but what we're hearing today is that the good news is that within the 3 weeks, we'll be able to ensure those individuals over age 80 can get an appointment and have their vaccine booked.
Yes, so those that are over 80, that again, if they have accessibility issues, obviously we'll determine whether maybe perhaps a mobile clinic is best suited for them. But in terms of congregate setting for seniors, that is one of our mobile teams are starting to, starting if not late next week, the week after, to start booking appointments for that particular setting.
Councillor McGarry, do you have any further questions?
Okay, thank you. And for those settings,
Yeah.
just one more, and it would mean that for those particular, for those particular settings, then
one of the things, sorry, Chair Redman, one of the things I will clarify too is even with our congregate setting, I didn't say this on the onset, we will be starting with those that are 100% senior congregate settings and then work from there. But our goal is hopefully if we don't late next week, we're looking at the following week to start those mobile clinics.
Dr. Wang, did you want to add something?
Okay. Yeah, I might be able to add a little bit of information that might be helpful. So there are various types, as you've all become aware of, seniors congregate settings. So the way the government has classified them, and the same is the same terminology we're using. So if you're a long-term care home, it's defined by the province. What's a long-term care home? And if you're what's called a high-risk retirement home, so within the category of retirement homes, there are those that have been defined by the government as higher risk, and what the province has directed is that those homes, because they are at greatest risk of serious outcomes and deaths and outbreaks, that their staff, their essential caregivers be given the vaccine first, and then it's the other seniors congregate settings, which do have seniors for sure, and seniors are a higher risk category for sure, but it isn't the highest risk category for homes. So it's the other, for example, independent living seniors that are considered, that they're able to live independently, right? And so but they live together in a home. So those, we are approaching the finish line with completing the long-term care home and high-risk retirement homes. And we are in the process now of booking the next group, which is the seniors congregate care homes that are not the long-term care homes, not the high-risk retirement homes, but the independent living homes. And yes, we want to get the ones that are 100% seniors, for example, we want to get all those done within the next 3 weeks. That's correct.
Councillor McGarry, does that answer your questions? Thank you. Councillor Erb, go ahead.
Thanks, Chair Redman. I just want to be clear with what has gone live today for the region is a pre-registration up until March the 15th. No, okay.
Deputy Hilton, do you want to clarify?
Yes, so it went live today, and everybody who is in phase 1 can register. There's no deadline for registering. It's just putting themselves on a list. So there's no deadline. We will continue with our pre-registration because it assists our local clinic. It is our vaccination appointments.
Okay. What I did hear today is that the people that begin to register, one of the things they'll need to supply is their postal code, and that will be determined where they will go for their vaccination. Is that how it's going to be determined in the Waterloo region?
currently that I don't believe that that's not how we're doing it in our region. It's based on the priority population. So it's based on where our clinics are and what the needs are. So it's not by postal code necessarily. Okay, Dr. Wang looks like she would like to answer fully.
So basically, a pre-registration system collects the information we're going to need for booking anyways. And as Deputy Hilton said, it allows us to plan even earlier than, for example, when the provincial booking system is ready. So it allows us to collect that information, and then that information feeds into a booking system, which we already have. We've been using it already to book the groups that we've immunized already. It's just that they've been a very, a very known group. It's not like a group out in the general population like the 80 plus. And now with the 80 plus that we can open up the pre-registration for, we're going to be able to get their information, and that will feed into the booking system. And when the province's booking system comes out, and we're gonna work with them to make sure that we can be aligned. They did indicate today publicly that what they plan to do is have their provincial system refer back to a local system if there is one, right? So basically it's to get that information earlier so we can better plan. And it will directly feed into the booking system, which is why the information that you're being asked is going to be this type of information that you would need to provide if you were booking. So it may not be for the purposes of pre-booking that you would need that information, but it just feeds into the booking system. In terms of site, initially when we don't have a lot of supply, right? We're not going to have that many choices in terms of sites, but as our supply increases, and at the same time as our planning is being implemented for those other sites that Deputy Hilton talked about that are going to be, up and running in March, that's also going to help us plan for those clinics that are up that will be up and running in March. But initially, it will be the clinics that we have existing for the supply that we have.
Councillor Erb, do you have a further question?
Yeah, if I may. So the postal code comment today came from General Hillier when a reporter asked him, how will people know where to go? And so maybe that's creating some confusion already. The final question I have is, I know in the last 24 hours and in the next 24 hours, we're beginning to vaccinate the workers in the shelter system. How will the people that live in the shelter system be notified or contacted that they can be receive the vaccine, and what category do they fall into?
Do you want me to take that, Shirley? Okay, so the reason that the shelter workers have been prioritized now as part of phase 1 is because of the outbreaks in the shelter system. It is not a setting that has been prioritized for phase 1, except when you are experiencing an outbreak such that there's system destabilization that can occur, and in that case, the healthcare workers that are providing support to that system, which could be destabilized, can receive vaccine in phase 1. So that's the reason. In terms of it's the healthcare workers that have been in that situation that have been prioritized for phase 1. In terms of shelter residents, as we understand, they are currently in phase 2 at this time.
Connie, go ahead.
Just wanted to add that those who are experiencing homelessness and in shelters are a core population group that the engagement working group is also working on. And so they're working within the shelter system to identify how best to vaccinate those living in shelter, what sort of supports might be needed to address any hesitancy. And one thing you'll notice about our pre-registration form is that you don't have to have an address to pre-register. And so you can register without that piece or a postal code, and we will find a way to help you get vaccinated.
Councillor Erb?
Yeah, so we'll be proactive in making sure that those people who are residents of the shelter systems will be registered and vaccinated, I think is what I'm hearing you said. Thank you.
Thank you very much. Councillor Strickland, go ahead.
Thank you very much, Madam Chair, and I really appreciate the work that the Deputy and Dr. Wang and Connie and everyone else working on this unprecedented vaccination rollout. Really difficult situation, but one that you're all very much aware of, that the community is very anxious about. You know, the longer this pandemic goes, the more and more people are anxious to get vaccinated. And so the pressure is really on government agencies and public health units to really get this right. And so I have a couple of questions just to better understand a little bit more how we're resourcing the vaccination rollout. And I'm not going to get into too much about the pre-registration and the seemingly idea, if I'm understanding correctly, that the integration with our system, with the provincial system at a later date. I can just say that based on my years of experience in regional council, it never goes well when local systems try to integrate with the provincial system. So that is going to be a real challenge, and I'm very hopeful that we have the right IT people on this, because the last thing we want to see happen is have that integration not work correctly. So I'll just leave that in your capable hands to make sure that we handle that with all the resources that are necessary. But what I want to really know is, you know, when this kind of hits the ground, so just take me through it. I pre-register. I understand from the deputy, I pre-register that I go on a list. But when I pre-register, do I get an acknowledgement back from the system saying, yes, you're pre-registered, stay tuned?
Deputy, do you want to take that, or Connie?
From my understanding, you will get an acknowledgement that you pre-registered. I don't know what it says in terms of what, how it's acknowledging you. Connie, I'm not sure if you know that.
Yes, I had a couple, well, we had many testers that have gone through the system to work out all the bugs. And we did also have some testers that are seniors who don't necessarily use technology as frequently to help us look at that. And so when you're done the survey, it says, thank you for registering, and you'll be contacted when it's time to book your appointment.
And so is that thank you in a return email or just on the system?
As I understand, it's just on the system.
Okay, so there's no, you know, typically when you register like that, you get an email acknowledgement, which I think should be considered when we look at communicating and rolling this out, and also making sure that we're clearly not building in expectations that since they've registered, they now are going to be anxiously awaiting and following their email every day for an appointment. So I think it's really important that we manage expectations on this. And that would be my point around the pre-registration. And so let's say they pre-register, they get the acknowledgement, they understand, and then they wait for a phone call, they wait for another email. How long do we expect them to wait until they get an appointment?
I can answer that. And again, I think I'll go back to, it's all vaccine dependent on, and then where they fall within that prioritization or sequencing as well. So we won't have an exact time frame for when they would be notified or when they would actually get their appointment, but we are working through our first phase. What's important is for us to be able to also, as I said as well, there is a drop box that will ask Are you available, I think within 15 to 45 minutes, if we notify you as a contingency in the event that we do have some openings. It's very difficult for us to actually give a time frame in terms of some of the bookings of this population as well, of all of phase one, when we know where our allocation is fairly limited at this time.
Well, okay, well, that's more information than we've heard previously. The expectation is you may have to respond within 15 to 45 minutes. You know, I think that's important that we communicate that to people. And let's say, you know, if you go back to your response there, Deputy, if it's phase one, don't we have a timeline by which we want to execute phase one? Phase one's to be executed by when? Sometime in April, if I remember the chart previously?
Deputy?
Thanks, Chair Redman. And understanding phase one doesn't have an actual stop and phase two doesn't have an actual start. So
right.
Phase one, we're looking at continuing into March and April, but we're also looking at, depending on vaccine supply as well, beginning phase two in April, depending on where we are with our vaccine. Our supply obviously is the determining factor on how quickly we get through phase one, but the goal is to get through a lot of this in March and in April, and then where we're beginning some phase two in April as well.
So supply dependent, but based on our plan, assuming we get enough supply, if you pre-register, you can expect in all likelihood to receive your vaccination sometime between pre-registration date and the end of April, based on our plan. Worst case scenario.
Again, yes, if we're looking at the provincial rollout, vaccine dependent, I think that is a fair assessment or a fair statement to be said.
So I think we need to say that to people, so they don't have the expectation when they pre-register, they're going to get a call within a day. There's a long lead time here. I just think we need to be as upfront and as transparent. I'm not implying that we're not being transparent. I just think that we need to make sure we manage expectations around this. So I appreciate your responses on that, and I hope you take my comments into consideration. Going forward, is there going to be a requirement for increased pre-registration, or is this just a particular phase, or with the province, most of the vaccine rollout will involve some form of pre-registration?
I would like to hope that we would continue with the pre-registration while we move into the other phases, because it does allow for our planning and then the booking of appointments. So it just allows for some easier further out planning once we start rolling, especially once we start getting into our essential care, our essential workers as well. When we start to hit the larger populations that are unknown to us, unlike some of our long-term care homes where we can reach out to them specifically. So yes, I would like to see us continue with pre-registration. It just helps us be prepared for booking those vaccines.
Okay, assuming we can integrate that with the provincial program, correct? There's got to be integration there between the provincial program.
Yeah, and I think I want to go back to what Dr. Wang had said earlier. We do have a system already that we use that is a provincial system for booking. So this provincial system already exists, that our healthcare our vaccinators or our super users, we call them, already put into our system, which is a provincial system. So the pre-registration is just for allowing us to be prepared for those appointments, and that information goes into already an existing provincial system. So when I say it will be compatible, it's because we already are using a provincial system. It just doesn't allow for an individual to self-register. It allows for those that are working in our vaccination clinics in our scheduling to put the information into the system. Our pre-registration is for us locally, and then once they register, it goes into the provincial system. And I believe get that right, Dr. Wang?
Yeah. Our IT folks have been superb. They've developed a way to make sure that this system that we're using can then feed into the provincial system, which does not yet have the capacity to allow for booking. So when the province says we're going to roll out booking, what we believe they mean is they're going to roll out the planned booking of this. They're going to enable the functionality in the provincial system, which all public health units have now, to allow for booking. It's like an additional functionality for this province-wide system that is not enabled yet. But what our IT folks have already done is really innovative work to, so that our pre-registration system and the booking system that we do have already now, they can all feed into this provincial system later.
Okay, yeah, I get it. And I'm just, I hope you're 100% right. And I'm just saying, based on my experience with integration of systems, we need to make sure we get that right.
It's been our experience as well. Just Councillor Strickland, so your point is very well taken. We are working very carefully on that. Because of that.
Thank you, Madam Chair. Just beg your indulgence for a couple other questions. So Deputy, when we target 12,000 vaccinations a day, and let's say, I understand it's vaccine dependent. You're being very cautious about that. I get that. But if we're able to hit our target of 12,000 vaccinations a day, how many healthcare staff do we need to administer those 12,000 vaccinations a day? And do we have those people available to administer 12,000 vaccinations a day?
Deputy Hilton.
Thank you, Councillor Strickland. We are working to have the clinics staffed. We have an aggressive human resources team working on ensuring that we do have the staff at all of the clinics that I've identified, public health-led clinics. Obviously, we're relying on our primary care clinics to be able to facilitate and staff within. But we have already plans in place, not only for our vaccinators, but for our screeners, for those that use the registration system, those that are monitoring those that have been vaccinated. So our plan is in place to be able to, once we hit the ramp up, we already have job profiles posted, looking for certain staff members as well. But I am told that they have ramped up and are prepared for this clinic. And they've been planning for staffing. It is a very aggressive staffing plan.
So we have the people available to execute the plan, or not just quite yet?
We do have the people to execute the plan as we're ramping up. Yes.
Okay, that's right. That's good. And then just about availability of the clinics as part of the HR plan, are 12 hours a day, open on weekends, how does that work to hit 12,000 vaccinations a day?
Once we are at full capacity of our clinics, we are looking at 7 days a week, 12 hours a day.
Okay, great. Thank you very much. I think that's important, and I'll appreciate all your efforts. Thank you.
And I think, Councillor Strickland, something that can't be lost, and notwithstanding some of your concerns about the IT and the transition from what we have sort of instituted locally vis-a-vis the provincial rollout, and what General Hillier is saying is that Waterloo Region, none of this task force sat around waiting. The IT people were on this right away, and there was a booking and a scheduling system that needed to be in place from the get-go, and they've been road testing it. So I think your caveats are really worth thinking about, but we have a system, and IT have worked really hard to make sure that it will not only work, but that we're hopeful that it will interface with the provincial rollout.
Well, I certainly appreciate that, Madam Chair. My questions aren't to be construed in any way being not supportive of the efforts of everyone, but this is a big responsibility. This is an unprecedented undertaking. The public anxiety is high, and as an elected official, I just feel it's important to ask some of these tough questions. Yeah, we still have a lot of work ahead of us, and not quite ready to have a celebration just yet. Let's keep the information flowing, and let's keep asking the tough questions to make sure we get it all right.
So Jowett, you're next. You have the floor.
Thanks so much, Chair Redman. And so I certainly am so encouraged to hear that we have a very systems or IT solid approach to this, and that our region was proactive. With Sean's point on the lead time, from what I'm seeing with this precarious supply issue, it could be a long lead time, or it could in fact be a very short lead time. So I think he's right on the money for the whole managing of the expectations. I think that conversation or that information that gets shared may look different from week to week almost. So I guess that's something you guys will have to grapple with. And so when I look at that, are we sending notifications to people's cell phones? Or are we asking them how they want to be contacted? Yeah, okay. And I don't want to get too far into the details. I'm just really glad to hear that there's this immediate sort of reach out that's coming. One of the concerns I had was that our shelter folks have had some outbreaks, and I do know that they don't really. I know the staff are wearing the masks, but I understand the nature of the folks in the homeless shelter, and they're not as excited about the structure rules that we sort of try and bring into place for these safety and security reasons. And I don't think they're doing it to be anything other than just, afraid or unsure or the usual challenges that we have in this particular circumstance. So I'll be glad to know that we're going to go and prioritize them as a population. I just want to know, how will we manage the anti-vax challenge in that? Like, because that's going to happen in congregate settings such as this, I believe. And do we have a solution for that? Do we have a strategy? Do we have somebody that can help support raising the awareness with maybe some folks that aren't doing so great, so that we can encourage more vaccinations in that particular marginalized community or congregate setting?
I'm wondering if Connie maybe wants to weigh in and just talk about the communications and the plans that are in place, some which have been executed and some that are in the process of being executed.
Sure, through you, Chair. There are lots of great conversations happening about just exactly what you're describing, and talking about ways that might increase vaccine confidence among this group. Some shelter leaders have suggested things like getting vaccinated together. And that, if the leaders in the shelter do it alongside shelter residents, that they might feel more confident. There's a lot of work that's been happening on planning for clinics to support the Indigenous community as they're identified in phase 1. Because shelter residents are identified in phase 2, that planning is a little bit further behind, but know that those conversations with the experts that know these populations best are really coming up with ways to address those issues.
Yeah, significant trust building, I would imagine, would be. And I'm also hearing grumblings that the millennial generation seems to be having a social media sort of, I don't know, there seems to be a wave behind anti-vaxxing, in that age group as well, that makes me wonder, it's a more complex problem than I think that we're going to solve, but how we're going to manage the folks if it's too much of the herd. And maybe this is for Dr. Wang, if it's too much that refuses the vaccination for the herd to become healthy, what are we going to do?
Dr. Wang, do you want to get out your crystal ball?
When we take a look at other jurisdictions that are, more advanced than Canada in terms of their vaccine rollout overall, there's still a healthy uptake of vaccine. And we also don't know at this point in time what's the percentage of people that would need to be immune for there to be herd immunity for COVID-19. So that is still an outstanding question. But what we're starting to see, and we're seeing this too in Ontario, is that the populations that you immunize, start to have less impacts. The number of outbreaks in long-term care home, the impact of the outbreaks in long-term care homes, for example, they're going down. And we're seeing this across Ontario. And what we also see is once people see the effects, once people see more people being immunized, once they see the success of the immunization program, which we're seeing early signs of, then that also increases vaccine confidence. And so we'll have to see, we'll have to keep working at it, as Connie said. doing our best to try to address those concerns where we can through our local engagement with groups, multiple groups, and at the same time, I think, you know, continuing to just promote, you know, the facts in terms of the effects of the vaccine on our community so far.
Is it worth
Councillor
looking at
Jowett, do you have any?
efficacy? Sorry, yes, Chair Redman, just one more. So is there any value in putting out charts and graphs that communicate the herd changes that are happening as we immunize, that demonstrate those kinds of things?
That's not really available yet, but I know that again, the experts at the provincial level, at least, I don't know about the federal for this one, but the experts at the provincial level are working on looking at the evidence. We can see it, you know, at a high level. We can see trends and patterns, but they're working on more scientific analysis of the data to be able to present things like, you know, how effective has it been in Ontario and things like that, and that will be forthcoming, and we'll be sure to share that. Thank you.
Thanks so much. Thank you.
Okay, Councillor Vrbanovic.
Thanks, Chair Redman, and I too want to express my thanks to the group that's been working on this, particularly Dr. Wang and Deputy Chief Hilton and many others. I do want to follow up though on the questions that Councillor Strickland was asking on the IT stuff, because that is an area of concern for me as well. And I understand that we've had some discussions with the province around integrating the systems. I guess my concerns lie in twofold. When the provincial system kicks in on March the 15th or thereabouts, will our data be uploaded into there? Because presumably the order that you submit your name in, as long as it's meeting the criteria in terms of the priority populations, you'll be taken in that order. And so when the new system from the province kicks in on March 15, will our data be uploaded ahead of time before additional names can start being inputted through the provincial system, so that other people can't circumvent those that have already registered?
I think Mr. Lochner would like to weigh in. Go ahead, Bruce.
Yeah, through you, Madam Chair. I just have our IT director on the line. I think what we could do is, rather than try to answer the questions individually, if we could capture the questions that we have tonight, I think we get a pretty good sense. And Terry can respond tomorrow to council as a whole with the Q&As, just to give comfort. I do take the point and the concern about the risks associated with uploads to different systems and linkages from systems coming from that world. And if it suits council, if that would be okay through you, Madam Chair, we can certainly put some attention of the IT director's time to this and get answers to council tomorrow.
Okay, thank you, Doc. Okay, Barry, just a sec. Dr. Wang, did you want to weigh in? I saw you unmuted.
Sorry,
okay,
no,
go ahead. Councillor Vrbanovic.
Sorry, back to me?
Yep.
Oh, okay.
You guys are all jumping around.
Okay, just to so just to be clear in terms of the full scope of my questions, then, is number one is, will our data be uploaded so that it'll be in there before the provincial data starts coming in? And then at that point, how will things proceed? In other words, will you be able to input yourself into the system from one or the other, and the orders will continue to blend going forward? Or will, at that point, the provincial system be the only active system for the categories in question, and ours will fall back on simply those that are looking to pre-register, and then subsequently we would see a similar transaction take place from a processing point of view afterwards. That's really the critical element in my mind. And at some point there needs to be clarity as to which system will prevail once the provincial system is uploaded and the data has worked its way in there. Because the last thing you want is, people starting to sort of get ahead in the queue, and that would really cause a lot of anxiety for people.
Thank you. Are those all your questions, Councillor?
Yep.
Okay. Okay, Councillor Foxton, do you have a question or a comment?
Just to piggyback on Barry's, if we're sending questions in, could we do reply to all? Because you're a really smart council, and if you've got good questions and great answers, I want to hear them, because maybe it's something I didn't think of. So if IT's responding, CEO Lackner, could you ensure that they respond to all of us so we have the same answers?
Yes, what I'd ask is if you have questions, if you could send them to me on the IT system, and I will collate those, and Terry and I will package up a response.
That's great. Thank you for those. And I think Councillor Strickland brought forward a lot of good points as well. I guess Deputy Hilton, I don't know if you or Dr. Wang or Betty, do you want to talk just briefly about sequencing and the fact about the drop-down box and the 15 to 45 minutes, and the fact that just remind council and whoever's watching on YouTube that are live streaming about what happens when you have 20 people registered and 5 don't show up, just sort of that, because I think our system has reacted fairly responsibly to that, and just talk about sort of having plan B, remind everybody how complicated actual scheduling might be.
Thank you, Chair Redman. I did want to circle back to that. The drop-down box, obviously through sequencing, it does allow the question, can you be available within a 15-minute to 45-minute window? And this allows us, as was discussed earlier, to contact the individual should we have somebody not show up or cancel an appointment, so that we are still filling those are fulfilling our goal in getting the doses administered. And so we are able to, the person is able to elect if they have a quick time frame to be able to appear at one of our clinics to fill one of those spots. It does allow for us to pull from that sort of contingency backup wait list. We do have the opportunity through the drop down as well to text people, because there's an option for people to choose whether they receive a text message to book that appointment as well. So the difficulty obviously is always once we do the booking, we know things will happen where things unexpectedly happen where people might have to cancel, but we want to stay fluid with our plan. So that is what we had built into the pre-registration, so that we can have that contingency plan in place.
And again, I think another really important message, and we covered it off fairly robustly, but that is the job postings for people to work as part of this rollout. But I also regularly get emails that I forward on to Deputy Hilton and the team on the task force for people who want to volunteer. So there is room and capacity for both people that would like to be hired on to be part of this rollout, as well as volunteer. And all are welcome. The community, I think, is really stepping up, as it always does. Are there any more questions or comments? I thank you. I think this has been a very timely, informative presentation. So I want to thank Dr. Wang, Deputy Hilton, and Connie McDonald very much for providing the information to us and the community, and very much thank all of Council as the Board of Health for asking, I think, focused and important questions. So thank you all very much. Sorry,
it looks like they're just thumbs up.
Okay, it's thumbs up, sorry. Stevie was thinking maybe you wanted to comment. Thank you all very much. I'll now entertain a motion to adjourn. This is moved by Councillor Vrbanovic and seconded by Councillor Armstrong. All those in favor? Barry's the only one in favor. That is carried. Thank you, colleagues. Have a good evening.